Mental health is just about our ability to cope with everyday things, and it's when things become unbalanced, people are unable to do that. Maybe they're not sleeping well, maybe they get stressed about the workload, or they've got a difficult relationship. It's when that balance tips is when someone may become mentally unwell. But there's all sorts of reasons it's not necessarily something from outside that triggers that off. It may be for themselves, they have an imbalance, an unwellness that comes just from how they are, their family history. There's a lot of complications for people to understand in mental health. What is the mental health service? Some people may be more comfortable going and talking to their leader in their church group. They might be more comfortable talking to someone at a cultural service, or it might be another person they trust, another professional in the community. A lot of us don't realise how much our mental health is impacted by our physical health. And you come to a different climate, you're cold, you're inside more, you're not eating the same food, and all of a sudden things are out of balance for you. The first thing I would say is that there's a lot of self-help available to people if they are concerned about themselves or someone else. There's plenty of areas online in particular. Or they could phone a number. We use the 1737 as a promotion tool for people to get immediate access to information around how to manage what's going on for them. If it's more serious than that, and it's not just about information, that they actually are needing some further assessment, we do recommend that people go to their general practitioner, which was often referred to as a GP, and that means that they need to be enrolled with that service. So it's important that people understand that they have a local GP that they can be enrolled with, and they go to that service. And if it's a mental health or anxiety issue, they can have a free service. They have to go to the GP, and then there's a free service after that to help with assessment and treatment. I would encourage them to talk with their student support, or if they've got some part-time work, talk in their workplace, because that way they've immediately got someone that can help them with that process, because that in itself can become quite stressful for some people. But most of our GP practices are also very experienced at taking on board new patients. Services such as Ngāketi have what's called a low-cost service, and so a lot of students perhaps would qualify to access that and be supported to enrol with that practice. If a young person's under 25, that happens through, it's called a youth brief intervention service, and we have a local contract here through Adventure Development. And nationally, it's through all of the GP networks. There will be a youth one which is up to 19 years of age.